Hello, everyone. Hello, good evening, and you're welcome to this webinar. Let me share my screen. All right, so we are live. Hi, you're welcome to this webinar to um, celebrate TDCN at 5. And in this masterclass, I'll be taking us through how to reverse type 2 diabetes safely using the foods around you. Before we just go into the topic of the day, I would like us to ponder on this quote by James Clear. This would set the pace for what we'll be discussing this evening. So, James Clear is the author of the book Atomic Habits, and he went on to say that every action you take is a vote for the type of person you wish to become. No single instance will transform your beliefs, but as the votes build up, so does the evidence of your new identity. I find this to be very powerful because in my journey with type 2 diabetes and just coaching people who are diabetic, I've come to realize that reversing type 2 diabetes is not an event, but it's a series of processes that builds up over time. And once you keep stacking those new habits, you just see that the evidence of your new identity becomes very clear. So every action you take, the action you've taken, the step you've taken to join this webinar is proof that you're eager to see your life transform, to beat diabetes and just reverse it for good. Now, why is this webinar important? It is because one, knowledge liberates. I find out that there's lots of misinformation concerning type 2 diabetes out there, and with the right knowledge, people are able to break from the shackles, from the chains of consistent high blood sugar levels, the chains that keeps them hopeless or believe that they do not have any control over over the outcome of um, their blood sugar control. It is interesting to note that in every 8 seconds, one person dies due to diabetes. This is global stats and it is very troublesome. In every 8 seconds, one person dies due to diabetes. Okay, so diabetes should never be underestimated because it is that disease that, when underestimated, can just take you up by surprise. And this webinar offers you hope that after going through all these various supplements and drama, you're finally able to find hope at last. So, like I said, this masterclass is important because knowledge liberates. Diabetes should never be underestimated because for every 8 seconds, one person around the world dies due to the complications of diabetes. Now, why should you listen to me? Well, we have lots of testimonials that proves that whatever I'm going to show you today actually works, right? But by way of introduction, my name is Margaret Ona. I'm a pharmacist with over 7 years of experience coaching people who are type 2 diabetic and just showing them the ropes of how to reverse the disease. I'm also the founder of the Diabetes Care Network, which is an organization that bridges the knowledge gap in the effective management of type 2 diabetes. I've helped lots of clients reverse pre-diabetes and type 2 diabetes as well, and I have been able to successfully help my mom manage type 2 diabetes safely despite having a comorbid condition that increases or spikes her sugar level intrinsically. I'm also an award-winning founder, a Mandela Washington Fellow, and the visionary at the School of Diabetes Mastery. Now, what to expect from this webinar? We are going to go through what I call diabetes 101. So I'm going to brush up what diabetes truly is because even scripture says that my people perish for lack of knowledge. So we are going to understand what diabetes is, the facts about type 2 diabetes that no one is telling you. We would debunk myths about diabetes. We'll look at the complications of type 2 diabetes and the true cost of type 2 diabetes. Then we go into the steps that leads to reversing this disease using simple foods we can find around us. And at the end, if you stay to the end, you're going to receive a special gift. Okay, let's continue. Now, what is diabetes? Diabetes is a chronic progressive disorder that affects how the body converts food to energy, resulting in high blood sugar levels, right? So, diabetes is that disease that gets or becomes progressive when you do not do anything to halt that progression. So, it's a progressive disorder that affects how your body converts food to energy, and as a result of that disorder you would realize that your blood sugar levels keep increasing. Now, it is important to understand what this hormone insulin is all about. Insulin is the hormone that is responsible for ensuring that your sugar level is within the normal range. Now, in diabetes there is a dysfunctioning of insulin such that insulin is either not produced at all, or insulin though produced is not, the cells of the body are no longer sensitive to the actions of insulin. In type 2 diabetes, it is often found that insulin is in excess amount because of the accumulation of bad eating habits, mostly because when you eat lot of carbs or sugar rich foods, it triggers the release of insulin, which then leads to the production of fat, and when fat begins to clog your liver and your pancreas, it reduces the sensitivity of insulin to the cells. So when there is presence of excess insulin in the body, you'd realize that you have high amounts of triglycerides and cholesterol, which is why people with type 2 diabetes usually have high amounts of triglycerides or cholesterol. You would also find out that you have what we call fatty liver. Okay, so you see that within your stomach region there are lots of fats there. So this is as a result of the excess production or excess amount of insulin that has resulted from unhealthy eating habits over a period of time. Now, insulin, remember, insulin is released in response to food. So for every time you eat, whether it is healthy meals or unhealthy meals, insulin is released. And if you keep eating carbs rich food, the amount of insulin release keeps increasing, and over a period of time insulin is released such that the cells are now resistant to the action of insulin. When this happens, you have what we call high blood sugar levels, and it leads to diabetes. However, there are different types of diabetes. It is important to know the type of diabetes you have so that you don't treat amiss. The way you treat type 1 diabetes is not the same way you treat type 2 diabetes. It is also not the same way you will treat gestational diabetes. So for type 1 diabetes, it is as a result of the destruction of the beta cells that produce insulin, which means that insulin is not even produced at all. And as a result, the sugar level in your blood will just increase, right? This type of diabetes happens early in childhood, and in people with type 1 diabetes, you'd realize that they have this inability to put on weight because insulin is not produced by the beta cells of the pancreas. So the way you treat type 1 diabetes, like I had earlier mentioned, is different from how you treat type 2 diabetes. For type 1 diabetes, the mainstay of treatment is insulin. So if you have type 1 diabetes and you're on this call, it is important to note that you have got to be on insulin in order to effectively manage your type 1 diabetes. And truth be told, there is no known cure for type 1 diabetes currently. There is no known cure for type 1 diabetes, and type 1 diabetes cannot be reversed. You can only manage it. Okay, so if you have type 1 diabetes, it is important to note that for type 1 diabetes you have to be on insulin. As you can see, insulin is administered subcutaneously, like underneath your skin. Now, it is very important that you understand the kind of diabetes you have. However, type 2 diabetes is the most common type of diabetes. About 70 to 80% of everybody globally that has diabetes has type 2 diabetes. So it is the most common type of diabetes. Even in Nigeria, over 80 to 90% of diabetics have type 2 diabetes. Now, type 2 diabetes is the most common one, and it happens due to the resistance of insulin, or the cells of the body becoming insensitive to the action of insulin. What is the result? This is because there is an excess amount of insulin in the blood. Remember, we said that insulin is released after every meal. So as long as you're eating, insulin is released. So if you keep eating every time consistently round the clock, insulin will be produced consistently, and the body gets desensitized or just resist what it sees every time, right? So this already tells you a way of sort of reversing your diabetes. Like, if you can reduce the rate at which insulin is released every time by practicing intermittent fasting, you start to see better blood sugar control. Now, type 2 diabetes responds to oral medication. Unlike type 1 diabetes that relies mainly on insulin, type 2 diabetes responds to oral medication, and it can be reversed. Type 2 diabetes can be reversed because it is majorly lifestyle dependent. Because type 2 diabetes is majorly lifestyle dependent, if you can fix your lifestyle, you're able to reverse it. There are other factors that increases your risk of coming down with type 2 diabetes, such as genetics, family history, etc. So if you have a family history of diabetes, say your mom, your dad, your relation, or your sibling is diabetic, it is important that you practice the lifestyle changes, especially how to use the food around you healthily, to see that you reduce your risk of having diabetes, or ultimately reverse the type 2 diabetes if you already have it. Now, obesity and fatty liver usually trigger type 2 diabetes. So if you are obese, your risk of having diabetes, type 2 diabetes, is high, right? And if you have a fatty liver, chances are that your blood sugar level would not be controlled. So in type 2 diabetes, there's also what we call sugar overload. Because there's sugar overload, it tells you an escape or how to sort of reverse it. So if there's a sugar overload, what do? You reduce the intake or the input of sugar into your blood, and by just doing that, you start to see significant reduction in your sugar level. Then certain diseases can also trigger diabetes, like hypothyroidism can trigger diabetes. The third type of diabetes that is very common is gestational diabetes. This occurs mostly in women. In short, it occurs only in women, right? And it's due to pregnancy, where pregnancy hormones in the placenta prevents the effective use of insulin. Usually, after delivery or after childbirth, this gestational diabetes sort of reverses, but in some women, it can progress to type 2 diabetes. It is therefore important that pregnant women should register for the antenatal care early enough so that they can get the best of care. Now, what are the common signs and symptoms of diabetes? You have excessive hunger, excessive thirst, excessive urination, blurred vision, numbness, erectile dysfunction, unexplained weight loss, non-healing wounds, or and muscle wasting. So I believe you watching this webinar, you've been experiencing one or more of these symptoms. Now, what are the facts about type 2 diabetes nobody is telling you? Number one, type 2 diabetes can be reversed and put into remission, right? So type 2 diabetes is said to be reversed when your blood sugar levels are normal for at least 3 months without the use of medications. Is this possible? Yes, you can actually achieve this. Type 2 diabetes can really be reversed and put into remission. The second fact about type 2 diabetes you're probably not aware of is that medication alone will not make your diabetes get better. With medications, you're able to manage it, because when you first started, trust me, you were placed on maybe one or two drugs, but over the years it was increased to three or four, and sometimes insulin will be prescribed for you, because it gets worse over time when you rely solely on medication. Number three, you are responsible for your health, not your doctor. And there is no processed food that is diabetics compliant, which is why this webinar is very important, where we'll be teaching you how to use foods around you that are healthy enough in order to help you reverse your diabetes. It is possible. You don't need to take special meals in order to reverse diabetes. Common myths about diabetes we need to just quickly look into. Number one, people think that checking their sugar level when they start feeling a certain way is the way to go about it. No, it's not. You need to have a routine or be strategic with when you check your sugar level if you want to get better glycemic control. I can know my sugar level by testing my urine. Please don't do this. Use a glucometer and determine your sugar level per time. And diabetes is not a spiritual attack, right? Diabetes is not a spiritual attack. Get help, get treated, and you will feel better. I can take one supplement to cure my diabetes. Nope, you cannot take one supplement to cure your diabetes. Like I said, there are various types of diabetes. So, which supplement is going to help you cure type 1, type 2, and gestational diabetes? Don't fall for all of those. You have diabetes, so now have to eat a special diet. No, you don't necessarily need to eat a special diet. You just need to eat your meals in such a way that supports your health goals, right? You just need to eat your meals that you have around you that supports your health goals. You don't need a special diet. Another myth is it is not safe to exercise with diabetes. No, this is wrong. You can always exercise whether you have diabetes or not. You just need to determine the kind of exercise that matches your energy level per time. And the last is I have to eat beans and plantain since I have diabetes. That is false. You don't have to subject yourself to beans and plantain simply because you have diabetes. Okay, let's continue. So this is a testimonial, and it's just beautiful to watch that by just uh taking action based on what we are going to show you today, you can bring down your sugar level in less than 2 months. Now, know your numbers. If you have noticed, I'm taking my time to sort of let you understand what diabetes truly is and how you can beat it with knowledge, right? So if you don't know what your normal blood sugar level should be, how would you know if you're actually on the right track towards reversing it? So number one, it is very important that you know what your normal blood sugar reading should be, especially if you're diabetic or you're a caregiver to one. It is important that you know that my fasting blood sugar level should be this range, my random blood sugar level should be this range, my A1C should be this range. It is important to know these numbers, because if you don't, you would not be able to determine whether the strategy you're adopting is working for you or not. Knowing what your sugar level should be per time is important to help you make informed decision. Now, number two, blood sugar readings are not static. So the range for fasting blood sugar level is 3.5 to 5.5. You have a range because the sugar level can fluctuate, but it should not go beyond it should not go below 3.5, and it should not be above 5.5. So anywhere within 4, 3.8, 5.2, 5.3, 5.4, 5.5, it's normal. So it is a range, right? And your value should always be within the normal range. For your sugar test, there are about 4 different types of tests you can do to know your numbers. but I'm going to be explaining the three common ones. Number one is the fasting blood sugar level. The fasting blood sugar test is the one you do every day. Let's see. Okay. So the fasting blood sugar level is one you do first thing in the morning in your fasted state where you've not eaten for about 8 hours, and it should be less than 5 it should be less than 5.5 or 99 milligram per day. That means it should be less than 100 for your fasting blood sugar test. Armed with this information, you know that whenever you check your fasting blood sugar and it's about 200, 300, something is wrong, something has gone wrong. So you need to know what the normal range is so you can assess or determine when you've gone above or below the normal range. Another thing I would like to point out is the A1C test. I've realized that most of us are focused on our fasting blood sugar test that we forget the A1C test. The A1C test gives you your it's like a scorecard or a report card of how well you've managed your diabetes or you've had good glycemic control over a period of 3 months. So if you're on this score and you've been diabetic for a year, 2 years, 3 years, and you've not done your A1C, you need to go and do your A1C test. So this is done in the lab. You have to go to the lab to determine your A1C, and we want it to be less than 5.7%. If you have between 5.7 to 6.4%, it means you're in the pre-diabetes state. And in pre-diabetes state, it is easy to reverse it quickly by just changing your lifestyle. But if your A1C is above 6.5%, it means that for the last 3 months you've not had good blood sugar control and you're diabetic and you need to do something to bring it down to the normal range of 5.7. So I know you're going to gain more from us, but if this is the only thing you've learned today, it is worth it. It is important that you go to the lab and do your A1C test if you've been diabetic for at least a year and above. Excuse me. Now, documentation. It is important that as you check your sugar level, you write it down in your journal or on your tracker. This is important to help you adjust the meals that work for you or the meals that work against you. The focus of this webinar is actually food, right? So I'm going to be using food as our examples a lot. There's a member of our community that ate a particular meal, and even though we've told them that this meal is not good, she just wanted to try it out herself to know if this meal was good for her. So what she did, we teach you how to eat to your meter, where you check your sugar level before the meal, and after you take that food, 2 hours later, check your sugar level and see if there's a considerable spike. If there's a huge difference, then that food is not good for you. Aside that, by just penning down your blood sugar readings over a period of time, say if you do every day, you document it, you write it down. If it is weekly, you write it down. At the end of the month, you can just go through your readings and see how far you've done and know that these drugs my doctor gave me is not working for me, because why am I taking these drugs and my sugar level is still very high? Or this food I'm taking is not working for me, because why am I not seeing any reduction in my sugar level? If there's a reduction, then you want to know the foods that you ate or the activities you carried out the previous day that enabled you get this good reading, and do more of that. So it is very important that you document and monitor your readings as you go through this journey. It will help you make data driven decisions. It will help you adjust your meal plans, your drugs, your doses, the foods you eat. And by being conscious and responsible, remember I told you that you're all responsible for your sugar control. It is not the job of your doctor. Your doctor is just there to assist you, but you are responsible. By watching this webinar or being here shows that you're responsible for your health. You need to take responsibility, and when you're responsible, you see that your risk of coming down with the complications of diabetes reduces. Speaking of complications of diabetes, remember I said that the reason why I do what I do is because diabetes, especially type 2 diabetes, is one disease that, if underestimated, can just take you off guard. As a pharmacist, I see patients come into the pharmacy almost every day, and I'm troubled, really troubled at the complications they experience. There is a sad story of a lady that had type 2 diabetes. She was nonchalant with it. She had a sore, and she did not treat it properly, and we just lost her, and it's an avoidable death. Because if you take responsibility, you would know that once you have a sore, you treat it aggressively. You do everything in your power to ensure that it heals. And if you have type 2 diabetes, it's you are responsible for reversing it, not just managing it. Now, one of the complications of diabetes is diabetic foot ulcer. I know we know people who have lost their legs due to amputation, their arms, because of diabetes. How about kidney damage, where you have to do dialysis almost every week? Or what's the cost of kidney transplantation? How about people who have retinopathy? Like, diabetes can actually or literally damage every organ in your body, beginning with your nerves. Diabetes can damage your nerves. As often as your blood sugar level is high, a nerve is going to get damaged. That is why most of you get what we call neuropathy, where you have this burning or needle-like sensation in your hands and your feet. It is important that you take diabetes seriously and do everything in your power to reverse it, because it can even lead to stroke. Diabetes can lead to heart attack, it can lead to blindness, it can damage your nerves, and it's this nerve damage that leads to a cascade of so many other complications. Imagine if your nerves in your foot are damaged, and you know that it's the nerves that gives the signals to your brain that something is going on, and the nerves in your foot is damaged, you get an injury, you don't feel pain because that nerve has been destroyed by consistent high blood sugar levels. Because you don't feel pain, you will not know that there is an injury underneath your foot that needs to be treated until it gets worse, and you have no choice than to cut off the leg. So it is important that you take everything we are going to tell you on this course seriously and implement it. What is the true cost of diabetes? Let's just take a few minutes to understand the true cost of diabetes. Number one, health. If you don't reverse your type 2 diabetes, if you do not do everything it takes to reverse type 2 diabetes, you're going to see that your blood sugar level increases, and this will damage your vessels and your nerves over time. And this damage to blood vessels, to the nerves, would lead to blindness, kidney failures, amputations, heart disease, and stroke, like I just mentioned here, right? So it is important that you ensure that your sugar level is within the normal range every single time. And if you can do that with less amount of drugs, the better for you, right? Now, diabetes will also reduce the quality of your life. Constant fatigue, recurrent infections, wounds that never heal. You're not able to walk because you have a sore and the wound is not healing. So the true cause of diabetes is enormous. It can even lead to shortened lifespan. I mentioned earlier that around the world, globally, in every 8 seconds, one person dies due to diabetes. It is that serious. Now let's look at the financial implication. Medication expense, like the cost of drugs for every diabetic patient, would increase as the years go by. So in year one, if you are taking just metformin and say Dalnil, metformin and Dalnil will not be able to give you the same results you had in year one by year three. It means I would have to increase it or add another drug to it. By year five, you'll be taking over 4 different medications, and the cost of these drugs are expensive, and you have to take it every day. So Just sit down and calculate the amount of money you've spent on medication over a period of time. Sit down and calculate it. How about hospital bills? I've had friends before now whose parents have to undergo dialysis, and it is extremely expensive. It is extremely expensive. Let's just do a rough estimate. Medication cost for say 5 years. If you're taking oral drugs like metformin, Downy, which is the benclamide, or sitagliptin, which is Gavus, you're going to spend at least 60,000 to 300,000 naira per year. This is even been very decent. And in 5 years, you're spending over 300 to 1.5 million naira. This is even me being very, very decent. How about insulin? Insulin is not cheap. Insulin is not cheap. So if you even want to calculate the financial cost, not even looking at the health cost, right? If you want to calculate the financial cost, you're spending in millions. And if you do not take the step now to reverse it, the amount is still going to triple in the coming years. Complications, right? If you have a complication, it means you want to do kidney dialysis. You're going to be spending at least 3.5 million to 7 million naira per year. This is being very honest. How about amputation surgery and rehab? What about heart attack or stroke treatment? What about eye surgery? The financial implication of not reversing diabetes is enormous. Then emotional cost. I remember when my mom was still in the active phase, where her sugar level was just fluctuating here and there. It was a lot on her mental health. It was a lot on my own mental health. So the emotional cost of diabetes is very significant. The stress, the anxiety, the depression, the family strain it has on so many families is a lot. Having said this, it is very important that we do everything in our power to reverse type 2 diabetes. Here's another testimonial where our coaching client referred us to another person, and she went on to say that her coaching was her saving grace, because anytime, any day, no matter the situation, she knows what to do. That's what we do at the Diabetes Care Network. We empower you so that you become masters of type 2 diabetes. Now, how do you reverse type 2 diabetes? Using foods around you. So far I've been able to introduce us to what diabetes is. So now we want to go into the meat of why we are here. How do you use the foods around you to reverse type 2 diabetes? Story time. As a Nigerian, 90% of our foods are carbs. If you're not eating rice, you're eating beans. Beans is more carbs. I think 60% carbs and about 20% protein. Plantain is carbs. Fufu, every yam, potatoes, these are carbs, right? So does it mean that we'll just stay on vegetables because we have type 2 diabetes? The answer is no, because carbohydrate is not the problem. Carbohydrate is not the problem. Again, I have to repeat it. Carbs are not your problem. It's the type of carbs that you eat and how you eat it that will determine your blood sugar control. The way your blood sugar will react to eating say boiled yam with lots of vegetable will be different from the way your sugar level would react when you take cornflakes with powdered milk and you then add sugar to it. The end product is glucose, right? But one is giving you dangerous glucose because it's even releasing into your bloodstream very fast, whereas the other one is not just glucose, it has fibers, it has minerals, it has phytochemicals that will also help your body heal. So carbohydrates is not your problem, it's the type of carbs that you're eating that is the problem, and how you eat them. Remember, at the start of this training, I mentioned that insulin is released every time we eat. So if you eat every 2 hours. If you're snacking every 30 minutes, it means the pancreas should be releasing insulin round the clock, round the clock. And of course, when you wear and tear would come in, and insulin will be released in such an amount that the cells will no longer be responsive to the action of insulin. So what do? You target the time when you're most active and eat your carb rich food at that time. The simple word is take your carbs as lunch. Okay, so if you want to eat your swallow with any type of soup at all, it should be done in the afternoon. And the kind of swallow you eat should be something that does not spike your sugar level, like your vegetable swallow or your tiger nut swallow, right? So it is not the food, it is not carbohydrate that is the problem. It's the type of carbs you're eating and how you're eating them that affects your sugar control. The truth, complex carbs are better than processed carbs. So we can argue that when you eat, what's that, let's take an example, tea and bread, that is carbs, and when you eat rice it is still carbs. Yes, when you eat rice it will be processed to glucose, and when you eat tea and bread it is just glucose you're eating, but one is healthier than the other one, right? Your rice is not just glucose, it also has fibers, and you're not eating plain rice, you're adding lots of vegetables to it. I'm going to show you how to do that, compared to when you're eating bread that is made of white flour, and once you consume it there is no nutrient attached to it, and it will just lead to a spike in your sugar level immediately, like immediately. So you need to determine the type of carbohydrates you're eating. Again, I feel this is very important. It is not carbs that carbohydrates food are not your enemies. Potatoes are not your enemies. It is the way you eat the carbs, the type of carbs, and how you eat it that determines your sugar control. Now, it is also important that you eat foods with low glycemic indices and pair them with lots of vegetable sauce. What it means is there are foods that have high glycemic index, and there are other foods that have low glycemic index. The higher the glycemic index, the higher the rate at which it would lead to a spike in your sugar level. For example, we have sweet potato and Irish potato. Irish potato has a very high glycemic index compared to sweet potato. So with this information, it immediately tells you that you should not be eating Irish potato because the glycemic index is very high, and it's going to lead to a spike in your sugar level. So you alternate it for sweet potato. Is sweet potato common around you? Yes. So you take sweet potato with your vegetable sauce. Is your vegetable sauce common around you? The answer is yes. You don't need any special kind of food in order to reverse type 2 diabetes. Trust me, if you eat your carb rich food in the afternoon consistently after now, you are going to see a significant drop in your sugar level. Once you eat your carb rich food in the afternoon, and in the evening you do maybe a vegetable smoothie or a salad, you're going to see a significant improvement in your sugar level, right? So yes, you can use the foods around you to help yourself in reversing type 2 diabetes. So have a vegetable sauce always in your refrigerator. Your vegetable sauce could be made with ugu, scent leaf, fresh tomatoes, dried fish, crayfish. Fish because they are rich in omega-3 fatty acids, and you need them to improve the sensitivities of your cells to the action of insulin. Now, pair your sauce that you've prepared with yam, sweet potato, your local rice, your plantain, using the plate method. Let's just quickly go into the plate method. Now, the plate method simply shows you how to pair your foods in order to get the best out of it. So in your plate, you divide it into two. The first half should be filled with vegetables, right? It could be your ugu vegetable sauce or green. Just fill this first half with non-starchy vegetables. Then the second half, divide it into two. A quarter of it should be your carbs, say your rice, your yam, your potato, your plantain, whatever starchy food you have that is rich in carbohydrates should come here, but it should be healthy. We'll talk about that later. Then the remaining half should be water and proteins, then with a glass of water. This is how you use the foods around you to ensure that you're eating healthy enough, you're fasting intermittently, and you're seeing better blood sugar control. Now, rule of thumb: I'm confused, what should I eat, what should I not eat? Any food that was prepared in a factory is a no-no for you. So you want to prepare your foods yourself. If you want to make stew, it's important that you use fresh tomatoes over tin tomatoes, right? So any food that has been prepared in bulk in a factory is a no-no for you. Any food that has been contaminated with toxins, pesticide, is a no-no for you. Any food that has been sitting on the shelf, in short, packaged crackers, cookies, bread, cereals, all are processed foods. They are going to spike your sugar levels very quick, and they are filled with lots of chemicals that you don't want to introduce into your body system. Now, this is an equation that I know is going to help a lot of people. The right food plus the right teas plus the right drink plus intermittent fasting is going to make you a champion of type 2 diabetes. I'm going to explain this. Right food in this equation means healthy foods, like we have explained using the plates method, right? So when you're eating healthy foods using the plates method, it means that you're eating the right way. That is your right food. So whether it's vegetable soup and tiger nut swallow you want to eat, as long as you're using the plate method and you're eating at the right time, in the afternoon, lunch, when you're most active, so that it gives the body enough time to digest and process the food. Once you get that right, and you do right things, because most times it's not about the food you're eating, it's about the foods you're not eating, the nutrients you're supposed to get from your healthy things that you're not getting. For example, cinnamon is very good in reducing inflammation and improving insulin sensitivity. So you why are you not taking cinnamon teas in the morning? Moringa tea is also very good in just improving the way your cells respond to the action of insulin, right? There is cloves tea, there is hibiscus tea. So when you have your right food and your right teas, when do you take your teas? I recommend you take them first thing in the morning, right? So the right teas, your right food, and the right drink. What kind of drink? Your green juices, your healthy smoothies, your healthy milk option like tiger nut milk, um cashew nut milk. These are healthier milk options that you prepare at home without artificial sugar. Then your alkaline water. When you add these three with intermittent fasting, you become the champion of type 2 diabetes. If it's possible for you to just take a picture of this equation, it is going to save you, because this principle here is what we've used over and over and over again, and the result is the same: blood sugar level crashes. You don't need any special supplements, you don't need any special swallow. You just need to use the principles I've explained in this webinar so far. Using this equation, and you would see a significant reduction in your sugar level, so much so that you'd have to stop taking your meds. Yes. So the right food, the right teas, the right drink, plus intermittent fasting would make you the champion of type 2 diabetes. When you become champion of diabetes and you add consistency plus time, when you do these things consistently over a period of time, you're going to reverse your type 2 diabetes. What it means is that you would see a visible reduction in your sugar level without you having to take medications. Now, is this you? I don't know if you're watching this live or you're going to be watching the replay. So You're not happy about your weight, you look sick, you've been diabetic for 1 to 15 years, you're tired of taking multiple sugar drugs, and you're experiencing at least 1 to 5 symptoms of high blood sugar level. Is this you? If this describes you, then you want to listen to what I want to say to you. Also, would you like your blood sugar level to be reversed completely? Do you want to be free from diabetes? Do you want to reverse the disease? Do you want to gain the knowledge and the applications that you need to reverse type 2 diabetes? Or you just want to achieve a stable fasting blood sugar level below 7? These are some of the motivations that makes people actually join our School of Diabetes Mastery, because they want to achieve one or all of these. Also, do you meet this criteria? Are you very serious about beating and reversing type 2 diabetes for real? Like, if you take everything I've showed you before now, like if you have taken note of everything I've explained so far and that reversal equation, and you just log out and go home and implement what I've just said, you're going to see real results. But if you need accountability, you would need a coach, you need somebody to hold you by the hand and explain in details, then you need to continue watching. Especially if you've tried doing this on your own and it didn't work for you, and you're very serious about beating and reversing type 2 diabetes for real, then you need to listen to what I have to say next. My special gifts for you. So maybe you've bought books, you've watched trainings where a particular supplement or tea was sold to you that worked for a while, then it stopped working. Trust me, I've been there. Or you've been to different programs, yet your sugar level is still very high, and you're tired of all the drugs and the endless cycle. I see you, I understand you, because I've been in that position too when my mom was still having high blood sugar levels despite the medications we were buying for her. So I had all of this in mind when we created the School of Diabetes Mastery. Listen, the School of Diabetes Mastery is not just another course. If you notice that for the first 20 to 30 minutes, I took my time to explain what diabetes truly is, the symptoms, what causes it, the types, and the knowledge you need to just give you a head start. You know that at the Diabetes Care Network, we are big on educating people. So with our experts coaching, I'll be holding your hands for the next 4 weeks. With our accountability framework, where we have weekly calls, you're going to see a transformation in your sugar level, right? So what do you get in the School of Diabetes Mastery? You're going to learn how to reverse type 2 diabetes naturally and sustainably, not on and off. You're going to be armed with the tools that you need, the knowledge, the guide, the resources you need to reverse type 2 diabetes, even if it runs in your family, or even if you've had it for 10 to 15 years. When you join the School of Diabetes Mastery, you're going to also discover your stress triggers, because stress increases your sugar level. So if you don't know your stress triggers, you will not know how to eliminate them in order to see better blood sugar control. I would also be giving you our meal plan, a 30 days meal plan. It is called Eat to Beat Diabetes. This has never failed. So this meal plan incorporates that equation I showed you: right diet, right teas, with intermittent fasting, your right drink, right, you become master of diabetes. So with our meal plan Eat to Beat Diabetes, everything is done in such a way that you're eating and you're also fasting intermittently. You're taking healthy teas and you're taking healthy drinks. So we're going to give you this meal plan for free, and would hold your hands in helping you just reduce your medication dose, so much so that you would not need to take drugs in order to see your sugar level get better. Now, this is a review from one of our participants that joined the School of Diabetes Mastery this August. He said that SDM was the best thing that happened to me in 2025. I discovered the secrets to managing and reversing diabetes, and my family won't fall into this trap. God bless you guys. I am happier and fitter. My eye is on the goal of keeping sugar reading below 100 milligram per DL. So SDM is like the best thing that has happened to him in 2025. You could see how genuine and happy he is even in this short testimonial. And he says that we asked this question because we like getting review. On a scale of 1 to 10, how would you rate your overall experience with the School of Diabetes Mastery? And the response we got was a 10, right? So inside the School of Diabetes Mastery, we are going to send you 3 videos every week that will explain what diabetes is, so you truly know what it is, the different types, the signs and symptoms. What I just did was like an introduction, but when you come to SDM, we explain it very well so that you know these things and how to prevent them from happening to you. We are going to show you how to use food for diabetes reversal. We're going to give you a free detoxification video. Remember when we talked about healthy drinks, right? So we're going to give you recipes, over 15 recipes of green juicing, and we'll show you how to reduce your medication dose so you don't need them over a period of time. So we also have our unique diabetes assessment tool that will tell us where you are in your diabetes journey instantly. We have a weekly live coaching call and a WhatsApp accountability group where you meet other champions like yourself who are on their journey to reversing the disease. You will also get our tracker, our books that answers all the questions you might have around diabetes. This is another review. It says, have you seen any improvement in your blood sugar level, your medication use, energy or weight since starting the program? Mind you, this program lasts for just 4 weeks. And it says that he lost about 4 kilograms and his fasting blood sugar level dropped from 412 to 139. Really. And he even recorded a random sugar level of 99. Do you see the instant transformation that you get once you register for the School of Diabetes Mastery? Now, we also went on to ask, how would you rate the teaching style and clarity of the lead trainer? And he gave us a 9, which is a great review. So it means that when you join SDM, you're not going to, excuse me, let me remove this thing from my slide. So it means that when you join SDM, you would not be filled with lot of jargons. We will give you the videos in bite sizes so you know exactly what to do per time, and you can always ask your questions, and we have supporting materials, right? So if you're serious, remember the criteria of people we are looking for. If you meet this criteria, if you're serious about beating and reversing type 2 diabetes for real, this is not about taking supplements or a magic pill. It's about you being serious about reversing type 2 diabetes. If you're not serious, then it's actually okay. Use what you've learned from this webinar so far and you're going to see results. But if you've tried on your own and you've not gotten any results and you need help, you don't need a magic pill, you don't need a supplement, but you need um the knowledge that would help you know what to do per time, right, in reversing type 2 diabetes. Or you've had type 2 diabetes for years and you're on multiple medications, yet your sugar level is high. If you meet any of these two criteria, emphasis is on being serious, because SDM is actually intensive. We are going to be sending you videos and we expect you to carry out the tasks and send us feedback, because we want to ensure that you get value for the time we are putting into the program and for your own investment as well. So if this sounds like something you would want to do, then I'm inviting you to register for the School of Diabetes Mastery for the September cohort. For September, we are starting on the 15th of September. That's this Monday, and we are It's going to run for 4 weeks. So from the 15th of September to the 15th of October would be with you in a special WhatsApp group, right? The investment is 35,000 naira. We already have people who have registered and are already in the group. So it means that we have limited slots available. So please rush now and register because we have limited slots available for this September cohort. Payment details is as seen on your screen, and after you've made payment, please send us proof of payment on WhatsApp and would enroll you into the School of Diabetes Mastery. Thank you so much for being here and for listening. Let me know if you have any question. Let me check with my phone. Let me check with my phone. Okay, so for some reason I'm not seeing any of the chats. If you have any questions, please leave them in the group from which you joined this webinar and we would answer you there. Thank you so much and enjoy the rest of your day.